Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, this is Lindsay Smith Rogers, producer of Public Health on Call. This episode is the second in a series about changing childhood vaccine recommendations. Dr. Ruth Karron is a pediatrician trained in infectious diseases, a global vaccine expert, and a public health professor at Johns Hopkins. She speaks to Dr. Josh Sharfstein, also a pediatrician, about the threat vaccine-preventable diseases pose to American children. They discuss 5 infections, 3 of which are prevented by vaccines that, as of yesterday, HHS no longer recommends for all children: hepatitis B, meningitis, and rotavirus. Let's listen.
Dr. Ruth Karron, it is great to see you this morning. So I've been reading in the paper that maybe the United States will adopt a different vaccine schedule from another country. And I thought that I needed to talk to someone about it. And so I decided to call you.
Well, I'm really glad to talk to you about this because it's something that concerns me and concerns lots of people in pediatrics and public health all over the country.
Now, there's a special reason I wanted to call you, and I thought maybe you could first introduce yourself a little bit to our audience.
I'd be glad to. So I'm a pediatrician like you. I'm trained in infectious diseases, and I've been working on vaccines for pretty much my whole career. And I've done some work in our country on vaccines. I chaired a committee called VRBPAC, which is a committee that advises the FDA on vaccine licensure. I was a member of ACIP, which, as I think everyone knows, advises the CDC on use of vaccines, and I do some work internationally on vaccines as well.
Can't think of anybody better to be talking about this with. We hear about the vaccines, but let's talk about the diseases that we're actually trying to prevent. I'm going to go through a list of a few of these that might, if what we're reading is correct, no longer be recommended in the United States. You ready?
I'm ready.
So one of these is the chickenpox vaccine.
Yeah, so chickenpox. So there are a few things to say about this, and most people who remember chickenpox think of it as a sort of a nuisance disease, with a lot of itchy bumps and goes through a family, and that's the end of it. But it really isn't, for a couple of really important reasons. One is that those bumps, and chickenpox is a virus, but that viral rash can get infected with bacteria. And if it gets infected with bacteria, people can have really serious, they can have blood infections, they can die. And before we had a chickenpox vaccine, there were about 13,000 hospitalizations a year and 150 deaths. So it's important for that reason. The other reason that people really don't think about too much is, the virus that causes chickenpox is also the virus that causes shingles in adults, and now actually in older children. And one of the things that we know is that if you get the chickenpox vaccine, you're less likely to get shingles later in life than you are if you actually get chickenpox. So those, I think, are really 2 good reasons to keep using the chickenpox vaccine.
Could I give a third? Because when I hear about chickenpox, my mind goes right to my pediatric residency when I took care of a child who actually, as I recall, died from chickenpox. And this was a child who had leukemia and was immunosuppressed. And this virus really can cause a very severe infection in kids who are immunosuppressed, even kids who are previously vaccinated. I just remember thinking, this child is going to be cancer. The chance of a cure from cancer here was, even then, over 90%, but the child died from chickenpox.
I think that's really fair, and I think it brings up, a bigger issue of why do we vaccinate? So, of course, we vaccinate to protect ourselves, but we also vaccinate to protect our community, right? To protect those who might not have either for some reason because of a medical condition might not be able to get a vaccine, or if they get a vaccine, might not have as good immune response as a normal, healthy person. So we do it for both those reasons.
Yeah, chickenpox vaccine really protects all the kids in the classroom and allows some kids to go to school with a lot more confidence, which is a big deal to me. Let's turn to another vaccine, the hepatitis B vaccine, which has been in the news. In particular, we just saw that the new acting CDC director has endorsed the idea of not recommending that every baby have the hepatitis B vaccine, and instead only really recommending that vaccine when the mother is known to have hepatitis B. How did you take that change?
So I think this is really a threat to health, to be honest, and I can explain why that is. So when babies get infected with hepatitis B, they don't have a lot of symptoms to begin with. It's not like chickenpox or not like measles. You don't know necessarily from looking at a baby that they have hepatitis B infection. But if they get infected either at birth, at the time they're born, or they get infected in the first few months of life, they have over a 90% chance of becoming a chronic carrier of hepatitis B. And if you are a chronic carrier of hepatitis B, then you are setting yourself up for chronic liver disease, for liver failure, or for liver cancer. So, and 25% of people who become chronic hepatitis B carriers in the first year of life will end up dying of some complication of hepatitis B. So it's really serious. It's not a death that we see immediately in children, but it's a death that happens over decades.
And isn't it also true that children who have chronic hepatitis B are infectious? They could
Yes, they
give it
are.
to
They're
someone else.
very so hepatitis B is actually a very, very infectious virus. And if those children, for example, if they go to daycare and, they're having their diapers changed and they're infants and they're playing and interacting with other infants and mouthing the same toys, those other children can get infected and caretakers can get infected with the virus. So some countries say, okay, we get that. We get that hepatitis B is a serious disease, and we'll just screen and we'll, just immunize the babies that are born to moms who are positive. Well, that's a problem for two reasons in our country, and it hasn't worked in our country. That was what we did in the 1980s, and it didn't work. And it doesn't work for two reasons. One is that about 18% of moms in our country don't get screened during pregnancy. So we don't know their hepatitis B status. But the second reason is, as we just talked about, hepatitis B is really contagious. So there could be somebody in the household who has hepatitis B that we don't know about. And hepatitis B is a really safe vaccine. It's used all over the world. It's been given to billions of children, and there's never been any evidence of any safety concerns. So it's really worrisome in some ways. Josh, I would say we would be going backwards,
Hmm.
right? We've made real progress. We've eliminated chronic hepatitis B in young children in our country, and this would be a backward step.
Let's move on to the meningococcal vaccine. I think of meningococcal meningitis as every parent's worst nightmare, a perfectly healthy child one day and a child who is dead the next day, literally. And I've certainly seen that in my pediatric training. We actually had at a hospital that I worked a couple of years before I started, one of the pediatric residents who was pregnant died of meningococcal disease and during her pregnancy. And so that cast a shadow for years over our residency. It is such a fearsome disease. Tell me about the vaccine.
So there is a vaccine that we give. It is currently against four types of meningococcal disease. This is a vaccine that we give to teenagers. We don't typically give it earlier in life. And part of that is because, meningococcal, the meningococcus, the germ, the bacteria, spreads really well in crowded conditions. And so we think, for example, of kids in dormitories in a university, or kids who, for example, go into the military and live in close quarters in a barracks. They are really at risk of serious meningococcal disease. So we give 2 doses to teenagers, and that's really been very useful. Countries all over the world do this. The vaccine that they use might differ a bit depending on, because different strains are in different countries. So the vaccine that they use may be different depending on the epidemiology in their particular country. But these are vaccines that are used all over the world, and they're used for exactly the reason that you say, Josh. I mean, these are rare diseases than some of the ones we're talking about, but the effects are so devastating. And, it causes death, but in the people who don't die, I mean, these are people left with brain damage, often left with amputations of some of their limbs because of what the bacteria can do. So this is a terrible, terrible disease that we can prevent by vaccination.
And I should also add, each case of meningococcal disease requires an immediate public health mobilization to try to prevent other cases. And people can get medicines that reduce the risk of getting sick, but it is very scary. And I certainly remember, as a health commissioner of Baltimore, having to scramble over a holiday to track down, I believe, 40 or so kindergartners who were exposed. And that is very traumatic for everybody in that moment.
Yeah, agree.
Okay, 2 more. The rotavirus vaccine. We're going to go to the other end of the age spectrum in children. This is given
Right,
to relatively young infants.
right. So, rotavirus causes diarrhea and dehydration in very young children. And unlike, it's sort of also at the other end of the spectrum in terms of how common it is. So, rotavirus is a very, very common infection, and actually, it's all over the world. There's not a country that you could go to that didn't have rotavirus. Before we started vaccinating every year, there were about 50 to 70,000 hospitalizations every year in young children in the first year or two of life from rotavirus. And there was a rotavirus vaccine developed. There have actually been a couple of them developed over the years. And we now vaccinate all babies in infancy. And we've virtually eliminated this. And I think, when we're talking about these common diseases and hospitalizations, of course, you and I are pediatricians. And the very first, probably second and third thing we think about is the health of children and keeping children healthy. But also, these things have economic implications. When you have a common virus that causes tens of thousands of hospitalizations a year, you ultimately save money. Vaccines are generally very good value for money, and you save money also by not having all of these hospitalizations. The other thing that you do, and I'm sure you can relate to this as thinking back to your pediatric residency, is for this disease, and one that I think we'll talk about in a few minutes. If hospital beds, aside from the money, if hospital beds are filled with children who have these infectious diseases that we can prevent through vaccination, there isn't room for children, say, who need certain kinds of surgery that's an elective surgery, or certain kinds of other care that's elective. There are many hospitals before we had these vaccines that didn't admit children during the seasons of these viruses because they were so common and because the beds were all taken up. So I think those are bigger picture questions to think about as well.
Yeah, I certainly agree with that. I certainly remember so many patients admitted with rotavirus. What I remember the most is one particular family that was so anxious about the health of their child. Every parent is anxious when their child is admitted to the hospital. But when you have rotavirus and there's so much coming out and the child is getting more and more dehydrated, and it was very hard to put in an IV line, because when child's dehydrated, the veins are not so easy to spot. And so it was traumatic for the parents. And I said, look, you're in a safe place. We can help. But it was like 4 or 5 days there and so anxious. And I just think about how that has been wiped out. What an accomplishment for that vaccine and for the, you know, health and well-being of the whole family, really. All right, I've saved one for you. The RSV vaccine is the last one we'll have time to talk about. This is one that you personally have been involved in the search, I should say, for an RSV vaccine. Why have you spent so much of your career trying to prevent this illness?
Yeah, so RSV is the most common cause of hospitalization for children under a year. And I just want to take a second and underscore that. It's not the most common infectious cause of hospitalization for children under a year. It is absolutely full stop the most common cause of hospitalization for children under a year. Can infect the lungs and make it really difficult for children to breathe. And one thing that you probably don't know is that in addition to everything else, I had a personal experience with RSV in one of my children when I was actually seeing patients in the hospital in December, which is when RSV circulates a lot in this area. And I probably brought RSV home to my infant son. And he was pretty sick. He did not end up being hospitalized, but I watched him struggle to breathe for days on end. And we talked about this with rotavirus, but RSV is also a terrifying disease for parents to watch. Even frankly, if their babies are hospitalized, it's terrifying and it's pretty scary, even if the child doesn't get hospitalized because of all of the work to breathe. And actually, there was a recent study that just tried to quantify the emotional distress of parents whose children were hospitalized with RSV, and it's really substantial. It's also, we don't quite know yet, but it's also possible that having a serious RSV infection when you're a young infant might predispose to some breathing issues a little later in life, like asthma. That we don't know that for certain yet, but there are some data that suggest that might be true.
And we should also say that RSV is life-threatening for kids, particularly those who have chronic lung disease, premature infants, for example. And so this is, on the one hand, can cause a transient illness that is going to come and go, but on the other hand, for some kids, could be really profound.
Absolutely.
So there's a new product that prevents illness.
Yeah. Actually, there are two. They're very similar. And these are actually, a lot of people call them vaccines. They're not vaccines, they are immunizations. They're an antibody that we give to young babies to help protect them, to get them through that first RSV season. Because one of the things for healthy children without lung problems, let's say, it's really their first season that's a problem. We all can get infected with RSV, in fact, over and over again, but most of us just get bad colds, and we can kind of manage this. So these antibodies work to protect the children's lungs. That's really what they do, and they're remarkable. These are, for those of us in the RSV community, we are so thrilled to have these products available in our country, at least. These are products that when in other countries that have used them, where all of the children get immunized, all of the babies at birth get immunized, or shortly after birth if they're a little bit older and born outside the RSV season, their rates of hospitalization for RSV have decreased 70 to 90% in that age group of 0 to 6 months. I mean, that's remarkable. And I think it's possible if we really use these antibodies wisely, and another product that's given to moms we won't talk about on this podcast. RSV could go the way of some diseases that you and I, Josh, saw in our residency, but the pediatricians in training today don't see anymore because we've been so successful at immunizing against them. Those are Hib disease and pneumococcal disease. Those are two other vaccines we won't talk about today, but that have virtually eliminated these serious diseases in young infants. And we could be on the pathway to do that with RSV if we continue to use these products in the way that they were intended.
Yeah, well, it's interesting. I don't want to date myself or date you, but I didn't see any of the Hib disease you're talking about, Haemophilus influenza, because I trained in pediatrics just after it was wiped out by vaccination. But I did see so many patients with severe pneumococcal disease, which also has almost been completely wiped out since my training. So I was sort of in that transition period with those two diseases and have a visceral sense of the horror that can happen from pneumococcal disease. But as we think about the fact that the United States might change its recommendations and that as a result, fewer people would be vaccinated, and as a result, some of these diseases could come back, where does that leave you, Dr. Karron?
Well, it really leaves me both, I think, worried and just sad because I've seen firsthand, like you've seen firsthand, what these diseases do to children, do to families, do to communities. We have made such advances, and our country has led on vaccines. And I'll give you an example. Chickenpox vaccine that we talked about. England, the UK, is now about to start vaccinating their children against chickenpox. And they didn't do it before, but they've looked at the data that we've generated in our country about chickenpox, and they've said, we want this too. We want this also for our communities, for our people. We've led for so long and we've made such remarkable progress. And I think you know the data on this, but since 1994, our vaccinations have prevented 500 million illnesses, 32 million hospitalizations, and over 1 million deaths. And the notion that a child or their family would suffer unnecessarily from a disease that we can prevent it's really very upsetting. It's, I think, upsetting to me and upsetting to those of us in our community who understand the power of vaccines.
Dr. Ruth Karron, thank you so much for coming to talk to me about this. We'll be covering different aspects of the vaccination moment that we're in. This one is a really important dimension to cover. Thanks so much for joining me so early this morning.
Thank you so much, Josh.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.